Good afternoon, and thank you for joining me. Thank you for joining us. My name is Tina T-Bone. I'm the Director of Media Relations for the Province of Nova Scotia. I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and good afternoon, everyone. Dr. Strang will now give us an update on the most recent cases and where we stand here in the province with COVID-19.
Thank you, Premier. Good afternoon, everybody. Today we're announcing 26 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 173. While most cases in our province continue to be connected to travel or a known case, as I announced yesterday, there is one confirmed case of community transmission and more cases are expected. So we have a number of cases that are still being investigated. Included in today's new cases is one additional staff member at the Magnolia Residential Care Home in Enfield. There are now 3 staff members and 2 residents of the Magnolia who have tested positive for COVID-19. To date, 2 other seniors facilities, a nursing home and a private retirement community, have 1 staff member each who has tested positive. Those facilities are R.K. McDonald in Antigonish and Lewis Hall in Dartmouth. Everyone who is impacted in these 3 facilities is in self-isolation, and the health of all residents has been closely monitored, and plans are actively in place to ensure appropriate and necessary staffing in the Magnolia especially. To date, Nova Scotia has 6,591 negative test results, along with our 173 confirmed positive results. I really do want to thank again Dr. Hatchett and Dr. LeBlanc and their team at the QE2 Microbiology Lab for their incredible work. Yesterday, over the last 24-hour period, this lab processed over 1,000 tests, where they were doing a maximum of 200 a day about 2 weeks ago, and now we're up to a capacity of 1,000. So incredible work, and I thank them for that. While we have 26 new cases out of 1,000 test results, that's good news. A lot of people are testing negative. That's what we want, is to be testing a lot of people and seeing a lot of them negative. We are seeing more, continuing to see double-digit cases in most days of COVID-19. We are seeing signs of more likely community spread. This does make me nervous. I didn't sleep well last night thinking about this. So it's really, really important. The next few weeks are critical, as I talked earlier, that our opportunity as this disease starts to spread in Nova Scotia, the critical importance in the next few weeks of us sticking with all the public health directives, good hygiene, maintaining social distancing, only getting together in groups of 5 or less if it's necessary and essential, staying at home as much as possible, having one person in a household unit do essential shopping. And if you are being ordered to be in self-isolation because of travel or you're a known contact of a case, critically important that people maintain that self-isolation. We need to have Nova Scotians, most people by and large are adhering to this, and I thank them. But there still are Nova Scotians who are looking for loopholes, ways to get around this. For instance, there's a Facebook petition going around. We have closed down sport fishing until for the month of April. There's a petition going around asking us to reopen this. This now is not the time to be thinking about how I can get out and continue my usual activities. And I have friends who are active fishermen and they're not happy, but they understand. Now is the time for us to stay close to home, minimize our interaction with others, protect each other. As the Prime Minister said earlier today, this is a very unusual and unique circumstance and critical situation in our country, and it is the duty of all of us as Canadians and Nova Scotians to support, do what's necessary, do what we're being told and asked to do for the safety of all of us. And I'll keep saying it again, that the way we get out, if you're not happy with the situation we're in and what you need to do and the limitations, well, the quickest way to relieve that pressure is to do what we're doing now and do it well. I want to move on and talk a little bit about our process and providing a bit of clarity to the media and the public about how we report cases as we get more and more cases coming to us. The lab is close to now working around the clock, which is, as I said earlier, good news. Each day we are here, the Premier and I, to provide an update on the number of cases from the previous day. What happens is that cases are reported from the lab to local public health. Each of those are then appropriate investigation. It happens. That information is then entered into the public health electronic information system, Panorama. It's that information from Panorama that my epidemiologists in the Department of Health and Wellness use every morning to identify the update number of cases. We want to be able to provide you, the media, and the public with appropriate, accurate information about from public health, and so there is a bit of a time gap. So we appear here at 3 o'clock. We base what we're talking about is information that's accurate and up to date as of about 8 o'clock to 8:30 each day. There may be very new cases that somehow come to the attention of the public or the media that happen earlier in each day before we come in front of the cameras. I want people to understand that even though those cases may become talked about publicly, it's not that they would not be included in what we're talking about at 3 o'clock in front of the cameras, but it certainly does not mean that there's not work underway at the local level. NSHA Public Health is aware of cases as soon as they are reported from the lab, and the management steps in terms of contacting cases and identifying their contacts and working with whether it's a facility or a workplace, giving them appropriate support and recommendations happens as quickly as possible. I just wanted to raise that as we get more and more cases, there may be some gaps that occur and people are aware of cases that we're not actually talking about as official numbers. I've mentioned before the 3 C's: care, community, and common sense. And I'd like to ask everybody to remember that we have workers, truckers, who are delivering essential goods across our province and traveling through Nova Scotia onto Newfoundland or from Newfoundland back. We also have Canadians who are trying to get home, traveling by air, land, and sea. It's important that we support these individuals who are traveling through Nova Scotia. Certainly, they're asked to self-isolate as much as possible. They don't have the normal supports that they may have, but they still need access to essentials of food, being able to go to the bathroom. I raise this because we're getting some reports of people not being welcoming to truckers and to travelers to provide them those essentials. So we need to help each other out, as I've said before, not penalize each other. I would like to follow up on comments I made yesterday about co-parenting. I do recognize that many people have complex co-parenting situations. The perspective I provided yesterday as Chief Medical Officer of Health is based on my role is to help all Nova Scotians be as healthy as possible. I did preface my comments yesterday by being clear that I was giving a public health perspective, and there certainly would be legal requirements that need to be adhered to and that people needed to talk to lawyers if necessary. I fully understand that many people have court orders in place. I'm not telling anyone to disregard court orders or ignore parenting arrangements. However, it's clear that these court orders and parenting arrangements could not have anticipated something like COVID-19. What I am asking people to do is, in the best interest of their children and their children's health, if possible and safe to do so, to have the parents to talk to each other, to work together to develop a plan that includes the understanding that they're moving about in a community, going from house to house, does increase the risk of transmission of COVID-19, and working together to develop plans that minimize everyone's exposure to COVID-19. If parents cannot do this for whatever reason, there certainly is resources. They can contact a lawyer to facilitate an agreement. Legal aid also has resources in place to help. This is a difficult and challenging time. All Nova Scotians have been asked to take steps to help slow the spread of COVID-19. It's a time for us all to work together, to care for one another, and develop plans which, first and foremost, keep our families safe and healthy.
Thank you, Dr. Strang. And I just want to echo his comments about the traveling public, and particularly truckers who are moving goods and services in and out of our province. It's incumbent on all of us to support them in a safe manner. The same as when some of our sons and daughters who are in other parts of the country are trying to get home to self-isolate with their families. It's important that we allow that to happen. And it will require all of us to be thoughtful, caring, and kind when it comes to ensuring that we can find our way through this. I want to thank so many Nova Scotians who've been taking our advice and self-isolating, following all the public health protocols. It is important that we continue to do that. So I just want to echo the comments of Dr. Strang. So with that, we'll take any questions you may have.
So we'll start taking questions. Again, we'll take one question and one follow-up in the allotted time that we have. We'll start with Natasha Pace at CTV. Go ahead.
Hello. This would be for either the Premier or for Dr. Strang. I'm wondering if you have any idea how many healthcare professionals right now are in self-isolation in the province due to COVID-19?
I can do that. So we don't have a number of that. I mean, we would know which healthcare workers are in self-isolation because of being in contact of a case. We'd have to do a bit of digging around to find that. But there's also healthcare workers who are may still be on self-isolation because they've traveled outside of the province, and we wouldn't necessarily know about them until they were ready to come back to work.
Go ahead if you have a follow-up. Tasha, do you have a follow-up?
Sorry, it was on mute. I noticed earlier today the Department of Health and Wellness did a Q&A on Instagram. Yesterday, Dr. Strang, you talked a lot about misinformation and trying to curb that. I'm wondering if this is another way you're trying to educate the public about COVID-19 and kind of help weed out some misinformation about the virus.
Absolutely. We recognize that helping people get good, accurate information is a critical part of supporting all Nova Scotians, keeping us all informed, keeping people calm and as they can be, helping them take appropriate measures. So there's a huge effort across government, we're led by my colleagues in Communications Nova Scotia to use many different ways. Website, you mentioned yesterday, the kind of short video clips, were very creative things to get information out to Nova Scotians. We want the Nova Scotia government to be the go-to place for Nova Scotians to get information on COVID-19.
Thanks, Natasha. Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. My first question is relating to the long-term care homes. Public health are investigating. I'm wondering, do we know how COVID-19 was brought into these homes in specific? I guess at the Magnolia place where we've seen another staff member test positive. Just an update there on that, and have all staff been tested at this point?
So we know that in all our three long-term care facilities, it's not being a resident first who then expose healthcare workers. That it's been healthcare workers who have been exposed either to each other, and there has to be somebody who at some point was exposed out in the community in some way that then unwittingly brought it in and was working either with residents or interactions amongst coworkers. That's part of what we're investigating in a couple of the circumstances. The other two other long-term care facilities, we know, for instance, how that the healthcare worker that has tested positive, how they actually got exposed out in the community, and it's related to travel. In the Magnolia, there's a much more complex situation we're dealing with about lots of interactions between staff at educational events, staff and residents. So part of what we're doing is trying to work all that out. All the residents in the Magnolia have been tested. Staff who have been identified as close contacts of each other or with a resident who's positive have been tested. The rest of the staff are being tested today. I expect to get results from that facility later today from the lab.
Go ahead, Jesse, if you have a follow-up.
Thank you. I guess the follow-up is kind of on Natasha's point on communication. We've identified that accurate information at this time is key, and you kind of let the cat out of the bag yesterday with regards to a website and map to help the public understand, the situation and maybe the severity. I guess I'm just wondering if you can give us a specific on when we might start seeing more information like that, and even just to help us understand, I guess, the severity of these cases.
I checked in with my communication folks today. I'm not a techno person, so all I know is that there's technological issues about then translating the information so we can get it up on the web, and then so we can update it easily every day. They're working to try to get this up and going by tomorrow.
Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Hello. My first question is for the Premier. Premier, it's April 1st. It's been a very stressful day for small business owners who are forced to pay rent on space that may not be generating revenue anymore. And as you know, some commercial landlords are rejecting your rent deferral plan. We're hearing from small business owners that what they really need is a break on their expenses, including rent. So you mentioned this briefly yesterday, but what is your government planning to do to lighten their load, and when?
So first of all, on the rent deferral, I think it's incumbent on all commercial landlords to recognize that all of their tenants aren't going to be the same. Some are still open. Some are still generating revenue and being able to afford to pay the rent. I think they need to, in order for us as an economy to come through this, we need these commercial landlords to recognize they need to provide a break to defer the rent on those that have been forced to close or either forced to close by the order or are closing because of the lack of customers that may be in a particular area, to support them. And the banks are working with these commercial landlords to support them, and we need them to support these small business owners who, through no fault of their own, are in a situation where their businesses have been closed because of public health, because we need to do everything we can to stop this virus. We as a province closed those earlier than almost every Canadian province when it came to restaurants and bars. It was done strategically to try to slow down and flatten the curve in our province when it came to COVID-19. We know, though, there is still more work to do, not only for small business owners, but quite frankly, their employees. The gap between when EI will kick in or the other federal programs, which are all there, we know there's a role for us to play, and we'll be announcing that in the coming days.
Go ahead, Shayna, if you have a follow-up.
Yes, I do. It's for both the Premier and Dr. Strang. We know that PEI is reopening some daycares for the children of essential workers today. And I know Dr. Strang has told us how shuttling children back and forth between locations creates extra risk or exposure. And I'm wondering, given you've closed licensed daycares but allowed unlicensed ones to remain open, can you clarify your policy on daycares? Why are unlicensed ones still open? And from a public health point of view, who is that designed to benefit?
Well, I think when you look at the ones that you're referring to that are unlicensed, is less than five, I think it's less than 6 children that are part of that, so the group is small. What we looked at as some of our larger daycares was important for us in the protection of our children, that they would close. Many of them, as I said yesterday, the workers are being paid, the costs associated with that is being paid, but like every business, obviously their profit line is being impacted. And the smaller ones, we felt at this time were providing the services that those who are still working in our economy required, covering for healthcare workers, other essential service families who would need that service. And I'm also happy that many neighbors are working with and helping their neighbors when it comes to childcare. If you're a healthcare provider and going to work, neighbors are pitching in, communities are pitching in to provide supports for that family. And the need in terms of childcare is being addressed. But we are going to leave daycares in this province closed until May 1st, same as schools.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Thank you. A question for the Premier. There were reports that Newfoundland and Labrador was basically about to run out of cash by mid-April, and it got to the point where they weren't going to be able to borrow anymore until the Bank of Canada stepped in. Now, of course, their fiscal situation is not in any way similar to Nova Scotians, but I'm wondering, Premier, whether Nova Scotia is actually borrowing above what it would be. Number one, is it borrowing? And number two, is it borrowing above what it would have had to do because of this crisis? And could you give us a bit of a fiscal update in terms of how the province is holding up?
Well, as you know, we just finished our year yesterday. Those books will go to the Auditor General and Public Accounts. They'll be I think you'll see an adjustment within the surplus that would have been there. We've taken as much available cash as we can, obviously, to make investments. But as we on a go-forward basis, this is a moving target. Revenue is being impacted across the province. We don't know how long this will happen. So while we try to build in capacity, flexibility, I would say to you this year all of that will be tested.
Go ahead, Keith, with your follow-up.
Okay, it's for Dr. Strang. I guess some prisoners are expressing concerns that there aren't enough social distancing measures in prisons, and they aren't safe if COVID gets in. Have there been any positive tests in provincial jails to date, and what will occur if there is a positive to prevent spread?
So I'm not aware at all that there's been no positive tests in either staff or inmates within our correctional facilities. There are a group led by Department of Justice and Corrections working with both infection control and some clinicians in the Nova Scotia Health Authority to try to put measures in place to minimize the introduction of COVID-19 into corrections, and also to take steps to minimize the spread. If we became aware of a case, we would approach that like any other closed setting where an outbreak, and public health would move in to support the facility as necessary. It would depend. We have a number of correctional facilities across the province, and so each one might be a little different. But we would approach it, even a single case, we would approach as an outbreak and apply the necessary outbreak measures to try to minimize the spread. Next,
we'll go to Cassandra Nadeau-Lamarche, Radio-Canada. Go ahead.
Yeah, so this is for Premier McNeil. Construction sites have been exempted from the 5-person rules, but my question would be, have any guidelines been provided to construction site managers to make sure that their employees work in a safe and sanitary environment? As we know that it's not always the most sanitary work environment.
I'll have Dr. Strang answer that.
Yeah, so I have had some correspondence with the Construction Safety Association about some of the things they're proposing to provide hand washing on sites where there may not be running water. I was also in a conversation this morning with the Deputy Minister of Labour at Advanced Education, working with the Construction Association of Nova Scotia and working with his staff. I'm going to be having a meeting coming up soon with the staff from Labour at Advanced Education and the Construction Association. They are putting together robust protocols for both big and small construction sites about how to adhere to what's required under the order, which is to maintain social distancing as best they can. There may be some circumstances for safety reasons they can't. But also how they're going to support things like hand washing and the other necessary measures. So lots of work going on in that space, and I'm going to be involved in providing a kind of a review of that from a public health perspective.
Go ahead if you have a follow-up, Cassandra.
Yeah, so this is again for Dr. Strang. So you've mentioned multiple times that wearing masks if you're healthy or if you're not a healthcare worker is not necessary. It's more harmful. But some health experts are suggesting that mask use is better than no mask use. So is this a policy or advice that you are reviewing, or?
That's actually, I'm aware of some of those very, very recent articles on that. It's actually one of the topics that's been identified for urgent conversation at the chief medical officers at the National Special Advisory Committee. What does it make sense of what this new evidence is actually telling us, and does it require a change in our position on masks? Like everything, evidence evolves, and we're always open to if there's new evidence evolving our approaches, our responses based on the latest and current evidence.
Next, we'll go to Nicole Monroe from the Chronicle Herald. Go ahead, Nicole.
Thanks. My question's for Dr. Strang. So earlier you talked about co-parenting. You made some clarifications there. Just to follow up with Shayna's question earlier in regards to smaller childcare operations, what would your advice be to parents in regards to sending their children to smaller childcare operations?
So we know that many parents already, send their send their children to non-licensed daycares. That happens frequently. We some basic things. Know where your child has been sent. Who do you trust and the operator? It's really important that parents don't send their children if they're sick in any way. If they're the family's meant to be on self-isolation, don't send your children to the daycare. It can be challenging, but help your children understand about the importance of hand washing. Kids can learn about hand washing at a pretty young age. It's more difficult with social distancing, but overall, we know that there are parents that are a part of our essential workforce, whether they're healthcare workers, first responders, that need support with childcare. So we have to have options in place for them. Parents need to make sure they have a good relationship with whoever they're handing the care of their child over to, and feel comfortable and safe with that environment.
Go ahead, Nicole, if you have a follow-up.
Perfect, thank you. My question is either for Dr. Strang or for Mr. McNeil. So the National Post obtained a federal document that suggested in a best-case scenario that the measures that we have in place will continue until at least July. And understandably, this is kind of play it day by day, but is it likely that July is when Nova Scotians will start to see restrictions lift?
Yeah, so I'm aware of that. This was my call, the national call that my colleagues here in Nova Scotia were on yesterday afternoon. This is a topic of conversation. We continue to be an important piece of our national dialogues among chief medical officers. I'm not sure if it's June or July. We know, but I think I keep coming back to the point that we know this isn't just a 2-week phenomena. It's a number of weeks, 6, 8, and 10 weeks at least, and that we continue to monitor this. And the other point that we need to be clear is that even when things start to get better, that we don't just take everything off all at once. That we have to then loosen up the restrictions in a very careful, managed way, and watch what the disease epidemiology as we're doing that. So even as we start to get back to normal, it doesn't mean that we get back to full normal right away. So this is a long-term period. Nobody knows for sure exactly how long.
And I mean, one of the reasons why when we started this, we became very aggressive, quite frankly, with the measures we took, closing restaurants and bars early, making sure that locking down our nursing homes, it was all about flattening the curve. And how long this will be, I think, goes back to what Dr. Strang said in his opening comments. That'll depend on us. If we follow the public health order, we continue to make sure we self-isolate, do all the things that are appropriate, we'll slow down and flatten the curve, which then will allow us to begin to gradually start opening up our economy again.
Next, we'll go to Brian Flynn from All Nova Scotia. Go ahead, Brian.
Hi, Finger. I wanted to follow up on Keith's question. Since your government's first term, you've made balanced budgets a priority. Obviously, this crisis has changed a lot of priorities all over the world. But I want to ask, how will the goal of keeping the budget in balance shape your decisions in the months ahead when it comes to things like public health or economic intervention?
Well, public health will be the number one thing that we are focused on. That's, as I said, it's why we locked down our economy pretty quickly. Part of our economy was shut down faster than any other parts in the country because we knew it was a place where a lot of people were gathering, a lot of people would be. So it really is public health. We came into this with a healthier economy than most Canadian provinces. We are putting in place and steps that allows our economy to take off whenever this is over. A lot of our public tenders are out now. We'll have some more that will continue to push out the door, and we continue to have part of our economy moving. But as I said earlier to Keith, we build in flexibility. But to be perfectly frank, it will be about making sure that we protect public health, and we'll do that with all the tools that we have.
Go ahead, Brian, if you have a follow-up.
I do. Today's also the day that the minimum wage increase was scheduled to take place. Given the circumstances, was the increase the right thing for both businesses and for employees?
We believe it was the right thing to continue to move forward with. This is providing an increase for low-income Nova Scotians. This provides a support to them to allow them to deal with the issues. And we will continue to work with those business owners in the coming days to deal with the issues of their own economic future and those that work for them. But we felt we had made that commitment with those Nova Scotians, and we were going to keep it.
Next, we'll go to Katie Hartai from News 95.7. Go ahead, Katie.
Premier McNeil, with many businesses and libraries closed, the homeless who are not associated with a particular shelter have almost no options when it comes to using the washroom. We've seen some shelters dip into their operating budgets to rent porta potties and hand washing stations, but unfortunately the ones that I was aware of anyway, they're no longer there despite the demand. I was wondering if this is on the province's radar to address the issue at all.
It is. They've been working with here with the municipality, and I do want to give a shout out to Mayor Savage and his council and all those municipal workers who are continuing to work, bus drivers and garbage collectors who are ensuring that we keep our city clean and safe and keep it moving. And we'll be working with them to how do we provide extra measures in terms of those that are living that are homeless.
Go ahead, Katie, if you have a follow-up.
Okay, thank you. I asked a colleague earlier this week to see if the province was considering capping payday loan interest rates during the state of emergency, because right now those interest rates can be as high as 60%. This was something you said you would look into, and I was just curious if there's been any developments with that.
I haven't been briefed on it since the question was asked a few days ago, but I definitely will do a follow-up on it. And I can reach out. We can have it sent directly to you if that helps.
Next, we'll go to Heather DeVoe from the Valley Today. Go ahead, Heather.
Hi, thanks for giving me the opportunity to pose a question. The Premier earlier spoke about border traffic, and we've been watching different reports from provinces giving various bits of information. Premier Higgs specifically has been reporting on border traffic coming through their borders, numbers of commercial trucks, numbers of people just coming through to socialize. Is the province of Nova Scotia going to be releasing that information to us?
I'm not sure what New Brunswick has put out, but I can tell you what we're doing is if it's commercial traffic coming into our province, it's getting through. We have an essential service line that go through. Healthcare workers who live in New Brunswick who come across the border are coming in. There are a number of other workers who live in New Brunswick, but their employment is in Nova Scotia. They're continuing to come through. The border for us was as much to tell Nova Scotians who are coming home that you must isolate for 14 days. Go directly home. Don't stop at the grocery store. Don't go to the drugstore. Go directly home and isolate for 14 days. Have a neighbor, a friend, or a family member pick up whatever it is you may need. That was our message at the border. And it was also for those who are coming in to socialize that this was probably not a good time to be coming. If you did, you had to isolate yourself for 14 days. And we do know that some returned home, but it is as much to deliver information information to Nova Scotians who are coming in and to ensure that we continue to have essential service going through our provinces. One of the things that concerned us, we have not stopped anyone who wanted to go through our province to go home to Newfoundland and Labrador. We continue to let them go through. We believe that's important for those that can get home to be home. It's like fellow Nova Scotians who are coming from across the country, we want our sister provinces to allow them to come through so that they can get home and self-isolate here in our province.
Go ahead if you have a follow-up, Heather.
I do. I think Premier Higgs's point of releasing some of the numbers behind that traffic was to underline the need for people to listen to the public health directives. For example, the other day he reported that there were 93 vehicles coming through various points of their border, could have been Maine, Quebec, or Nova Scotia. He said there were 93 vehicles coming through for social purposes only, and he used this number to tell people, you should be staying home. So I guess we're looking for some of those numbers, like numbers of commercial truck traffic coming through. Is the RCMP or the Border Patrol, are those numbers being counted?
I will look into it. I don't believe they would have that degree of detail. The message has very clearly been on the commercial side. We need product brought into our province. We need to be able to ensure that we keep our shelves stocked. Drugstores have the appropriate stuff they're required to deliver service to Nova Scotians, so that commercial traffic will continue to come through. And again, what we did at our border really was information to tell Nova Scotians who are coming home that you must self-isolate. Like every Canadian province, we were very concerned about the snowbirds that were coming back, or people who had taken their March break and had gone outside of our country. We were concerned that they understood that when they came home, it was not a chance to go to the grocery store before you went home. It was that you went directly home for self-isolation. And I do know that some people who were coming in for social things who were stopped at the border turned around and went back. But I will ask the question, but I don't believe they would have that much of a detail.
Next, we'll go to Drake Lowthers from the Port Hawkesbury Reporter. Go ahead, Drake.
My question is for the Premier. Municipalities are about to release their next cycle of biannual tax bills, and obviously HRM has different cash flow and reserves than, say, the town of Port Hawkesbury. So is the province looking to provide any guidance or assistance with the universally mandated province-wide plan for deferrals?
Minister Porter has been working with the Nova Scotia Union of Municipalities on what programs or things they could do to help support them, but to this point there is no detail on that.
Go ahead, Drake, if you have a follow-up.
I don't. Thank you.
Great. Next we'll go to Pat Healy from the Laker. Go ahead, Pat.
Hi, this question is for Dr. Strang. Given that COVID-19 is now in Enfield and Emsdale area, is there much risk to the community?
So I think there's a risk in any community across Nova Scotia that we have to understand that COVID-19 may be there. We've got cases of COVID-19 in a number of communities across Nova Scotia. All the public health measures we're saying around personal protection, social distancing, mass gatherings, staying home as much as you can, that's important for everybody to understand. I don't want people to come to a false conclusion about risk by comparing themselves between one community and another. Public health, when we're aware of cases, we move in and we'll take action to identify close contacts, and if necessary, we'll push out information more broadly in a community. But we need to pay attention to this and have an equal level of concern all across the province.
Do you have a follow-up question, Pat?
Yes, I do. Also for Dr. Strang. Is there anything residents in these communities can do to be prepared, especially if there might be more cases?
So I think it's the same advice for all Nova Scotians. Follow all those prevention measures. If people are concerned that they may have because of their symptoms that they may have COVID-19, doing the online self-assessment and getting referred in as necessary for testing. So again, there's nothing special in those communities that you represent, Pat, that doesn't apply across the whole province.
Next, we'll go to Bill Martin from Six River News and Radio. Go ahead, Bill.
Thank you, Dr. Strang. Dr. Strang, I'm anxious to know, since the epidemiology of this you've made clear since day one relates to those who traveled from outside the country and those connected with them. More recently, you've said we have community spread and expecting more. Does that raise alarm bells with you even more so?
Well, as I've said, it does make me more concerned. We're doing a good job, I believe, on having travelers self-isolate. We're testing them. The fact that the vast majority of the people traveling that we've identified, when we follow them up, they have been adhering to self-isolation and they have very few contacts. That's all good news. But as we're seeing more signals of spread potentially in our communities, excuse me, it becomes a bit harder to kind of wrap our hands around this. That's why I keep coming back to, with the Premier and I, the way we deal with this is everybody taking the steps. If we are all staying home as much as we can, minimizing our close contact with others, only doing essential travel out in our communities, essential shopping, really, really good hand washing, all those steps. That is what stops. Even if the virus is in our community, it won't completely prevent it, but it greatly reduces the spread within our communities. And because of that, people who are most vulnerable to severe disease are getting the maximum protection they can get. We're going to have minimize the impact of on our healthcare system by having much smaller numbers of people severely ill and requiring attention. It all comes back to the prevention, doing the things that we can do, staying apart from each other, not infecting ourselves by good hand washing and not touching our face, all those things. This virus is preventable to spread. Not completely, but we can greatly reduce the spread by doing all the things we've been talking about. And that's why we need to have everybody across the province focusing on that for the next few weeks.
Go ahead, Bill, if you have a follow-up.
Mr. Premier, there are 3 road entries into Nova Scotia from New Brunswick. The Trans-Canada Highway, you are staffing and handing out information. The one closest to that, below Amherst, is closed. But the other entry at Tidnish Bridge is wide open with no manpower there. Why is that?
Well, obviously the volume of traffic that comes into our province is coming across into Amherst, the one that we're manning. As I said to you earlier, it was to make sure that Nova Scotians who were coming home recognized they had to self-isolate for 14 days and go directly home. We also wanted to make sure that those who were coming in for whatever other reason recognize those rules applied to them, and we wanted to make sure that they had a choice to go home or go back where they came from, or that they could come into our province, but they still had to self-isolate. And the volume of people coming into our province is coming through that area.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. And just as a follow-up to Dr. Strang's opening remarks, we've had 26 cases today, our largest number yet. And while this is worrisome, I think it's important to put it in context. We tested more than 1,000 people in the last 24 hours. 26 tested positive out of more than 1,000. What we are doing as a province so far is working. This doesn't mean that we become complacent or arrogant. The virus does not discriminate, and it moves quickly. So we must remain vigilant by following all of the public health protocols. Stay at home, wash our hands, and if it's absolutely necessary for you to go out, stay 6 feet or 2 meters away from other people. Flattening the curve is literally in our own hands. Our frontline workers are risking their lives to protect those who need care. The very least that we can do is protect them by following these protocols.